Thanks so much, Suyin. So welcome everyone. So delighted that you could join us for this first presentation of the Kaiser Permanente Ashby Village community benefit offerings. We'll get a little bit further into introducing our guest and talking about pain management, the way we're working with, but I wanted to just give a little bit background of how we came to this today. Last year, as Ashby Village was preparing for its 10th anniversary, we reached out to Kaiser Permanente, our friends. We've done a lot of work together over the years, and met with a woman, Jessica Arlene, from the Public Affairs Center at Kaiser, and started just discussing how Kaiser might be willing to support our village. She came over for a visit. We had a great chat. And she joined me over at an over 80s conversation group, support group of Ashby Village. And it was a very beautiful, sweet, meaningful discussion. We were there for about an hour, and both she and I were very, very moved by the sense of connection and support that people were giving to one another. So fortunately, she and Kaiser came forward and became key sponsors for our 10th anniversary. And we talked about what else we might do together. And from that point, we started talking about possibly producing some programs. And Jessica was aware that for Kaiser, supporting older adults is a strong new incentive. And so out of that, conversations formed, and we started looking at, they have these incredible professionals who provide us with support in all different ways, and how could we create some programming where they could support Ashby Village members in the larger community. So today is the first offering, and really delighted you could join us. I wanted to just say to all of you, if you don't know yet, Ashby Village has been very successfully and actively supporting our community members during the shelter in place and during COVID in the ways that were safe. And more recently, we've started providing in-home support to people who have been vaccinated with our vaccinated members, so volunteers. So anyway, things are picking up. As I mentioned when you came on, our walking groups have started up again, and there's lots more to come. So if you are interested in finding out more about how you can engage with Ashby Village as a member, a volunteer, a donor, and or a enthusiastic supporter, please check out our website or come to join us at our upcoming living room chat, which is Tuesday, May 25th, 2 to 3 p.m. You can see that information on our website. You can probably see it in the chat right now, but please join us, because we're here to serve our larger community. I also just wanted to invite and encourage you to know that while today's event is free, Ashby Village does provide a tremendous amount of support to our community, and we would welcome any contribution. We're a nonprofit organization on a shoestring, and certainly would welcome any support. So that link will also be in the chat now, and you can go to our website at any time. So with that, I want to pass it over to Roberta Pressman. Roberta was the visionary who had the idea of this Healthier Aging initiative, and the Embracing Change series supported that moving forward. And Roberta will introduce Jeanette, who's worked with her on this, and our presenter. Roberta?
Good morning. Good morning. Welcome to our spring Embracing Change lecture. And for those of you who are new to Ashby Village, I just want you to know that Embracing Change is the educational component of our Healthier Aging initiative. And our goal is to bring you current research and information on health and wellness. So we are particularly happy to have this new collaboration with Kaiser, so that we can get even more cutting edge information from their research and clinical staff. But we're also really interested in hearing from you. So if you have suggestions or ideas about the kinds of topics you would like discussed during our Embracing Change lecture series. Please put your ideas in the chat or get in touch with either Jeanette or myself, and we will try to find speakers for you on that topic. So do put them in the chat if you've got some ideas today. Before we introduce our speaker, I just wanted to make a couple of announcements about our healthier aging exercise classes. Some of our instructors who have been teaching valiantly over Zoom all year are needing a little break. And so our aerobics class taught by Ann Aronoff will be on hold for the summer. And it's possible that our yoga class will be on hold as well, but we'll keep you posted. But the good news is our hiking program is up and running, and we have a whole bunch of hikes planned for May and June and hopefully throughout the rest of the summer, so you can all get outside and breathe and be in the woods with us. And we're almost every one of the hikes will have an easier or more challenging option. So everybody is welcome. Just look at the description and decide where you fit in the hike, and watch the calendar and do sign up and join us. It's really a lot of fun. Okay, with that, I believe I'm finished. Yes, I want to introduce Jeanette Ward, recently joined us as my co-leader at Healthier Aging, and I'm so delighted to have her. And she will introduce our speaker today. Thank you.
Thank you. Yes, it's my pleasure to introduce Emilia Moreno, who's a doctor of psychology and has worked in different specialty clinics for Kaiser Permanente since 2012. As a bilingual, bicultural psychologist, she enjoys collaborating with patients as they make positive and healthy changes. Her focus for the last 5 years has been working with the Oakland Kaiser Pain Management Department, as well as providing surgical candidacy clearances for the Fremont Bariatrics Department. As part of her pre- and post-doctoral training, she completed various rotations at the Department of Physical Medicine and Rehabilitation at UC Davis Medical Center. She also trained at the Medical Center Spine Center, providing pain management treatment. And on a more personal note, she enjoys gardening, being in nature, and spending time with her family and friends, traveling when she can, and learning more about cultures and the cuisines. So thank you, Emilia, for being available to us today.
My pleasure. And thank you, Jeanette, for the wonderful introduction. So yes, I think this is very exciting for me, and also to share some of the content and information that our chronic pain program at Oakland Kaiser regularly shares with our patients. But I understand that not all of Ashby Village clients are Kaiser patients. So again, it's a wonderful opportunity to share some of the recommendations that we like to give people. So I think as I get into the discussion today, it might provoke some questions from you all. So I think the best approach, if you have specific questions, for example, about medication or things like that, making sure to engage with your personal physician is really important. And so I won't really be addressing any medication type content today. Medication is obviously a part of the treatment for chronic pain, but from what we know from the research, a lot of it is really for psychologists and physical therapists. It's really behavioral interventions, things that people can do on your own in terms of managing the discomfort, the sensations in your body, in terms of the persistent pain, and also managing other parts of your life. We are very complicated beings. We're mind, body, spirit. And so we can't neglect those aspects of life either. So making sure to address any, emotional things that are going on, any, we use language like psychosocial. It just basically means like how you're feeling emotionally, your psychological functioning, but also that can involve other aspects that people don't have a lot of control over, like things like the neighborhood they're in, poverty, crime, things like that, or other factors in terms of maybe not so much in our area, but disasters, natural disasters that can impact a person's life and living situation. And all of that, as you can see, adds a lot of stress to someone's life. So stress is a huge component that we address in our clinic when it comes to helping people get better from chronic pain. So I just wanted to kind of warm us up a little bit as I start sharing this slide. So let me get that going. So basically today we're going to be discussing the best approaches to helping people with pain through mind-body approaches, so behavioral interventions, as I mentioned earlier. And in terms of what to expect today, I would like to just, this is such an interesting topic for me. Here at the Chronic Pain Clinic, we have a class that's 8 weeks long. It's 2 hours per session. And we still run out of time in terms of some of the content and things that we want to discuss. So today is just going to be like a very kind of brief introduction. My hope is to give you all some practical information. If you are dealing with chronic pain, probably one of the questions that you have is, what can I do about it? So we'll cover that towards the end in terms of like a plan that we share with our patients. So we'll cover the basics on what chronic pain is. So we'll differentiate acute pain, which is new pain, from a new injury. And when it becomes chronic, it's a completely different situation. And again, we'll cover some of the strategies that we know help with dealing with persistent pain. So as was mentioned earlier, if you can please put your questions in the chat box, and then we'll go ahead and cover those at the end. So just very briefly, I wanted to share the definition for chronic pain. In other parts of the world, they do call it persistent pain, same thing. So the way it's defined, it's an unpleasant sensory and emotional experience. So it's really important to take that into consideration, because yes, it's physical, the sensations in the body, what's called nociceptive pain. But, along with that is the emotional experience of dealing with that, with what's going on in the body. So we'll get into that in just a little bit more, a little bit later. And also, chronic pain is a real medical diagnosis. So our department, we talk a lot about centralized pain, or some people call it neuroplastic pain, which is the concept that pain signals are coming from the brain, and so the brain and the nervous system are producing these signals. So, sometimes when people hear us mention that, there can be a little bit of pushback. Sometimes patients think that we are saying that it's all in your head, that it's imagined, or that they did something wrong. They brought this on to themselves. And so we want to clarify that, yes, it is. Yes and no, it is in your head, but it's in your brain. So it's a process that has occurred over time where your brain and nervous system have gone a little bit haywire, and they've become too good at sending these pain signals that are not useful to you. So we'll get into that as well in a little bit. And again, the proven methods, again, very behavioral things that people can do. So these are more active kinds of interventions. So I always make a distinction between these approaches and what I consider to be a little bit more passive interventions. Like, if you're taking medication, that's just something you're taking. It's not something you're doing. Or, procedures, those are kind of passive as well. So yes, definitely we acknowledge that these approaches take commitment from the individual, that you have to decide, I want to go in this direction, and then decide how you're going to do it. So starting gradually is really important. So a little bit more about our program. Again, we are housed at the Oakland campus, and we are a team of different disciplines, as you can see from this slide in front of you. So we have a pretty robust acupuncture clinic. Acupuncture has been proven to be one of those helpful holistic modalities that can help with chronic pain. We have our nurse care managers, a pharmacist. We have several physicians, as well as physical therapists. There are 3 psychologists on our team, which is actually quite nice to have colleagues. And we have other specialty support. But as you can see, I also listed the individual. Our patient is part of the team because, you know, we can come up with recommendations and suggestions, and we provide support as well. But if the individual isn't able to commit or start some of these changes, which does take time, the person has to start carving out time to, you know, to do these things. And so we acknowledge that sometimes it's not the right time for someone to devote all of the time and energy. Maybe they are unemployed, or their housing is a little bit unstable, or, you know, other situations are going on that are a little bit more, are taking more priority. So we understand that. And there are times when some of our patients come into the clinic, we don't see them for a while, and maybe they return, you know, down the road, and they're more ready to dive into the program. So it is very much a program where it takes, like I said, commitment from the individual. It takes a lot of work. And I always tell people, a lot of this work is very quiet work. Others around you may not be aware of everything that you're doing. It'll make more sense as we go, but, you know, checking in with yourself, noticing your mood, noticing your stress level when you are feeling overwhelmed, you know, that's a lot. That's a lot of mental energy to do that. So, and that's really where a lot of the progress can happen for people. Sorry, I've got a little bit of a dry mouth. And so some of the goals for our program I've listed here, but I think in terms of what the ultimate goal is, it's really to maximize function and minimize pain. So whenever I have a new patient, I always like to talk with them about their expectations. Why do they want to engage with us? What are they looking for? Because that gives me an idea of where they are in terms of the stages, right? It's very common that many times people say, you know, I'm just looking for a medication to help me. You know, I can understand that because of the fact that maybe they've dealt with this for quite some time and they just want some relief, right? Other times people say things like, I just want to get rid of the pain. I want it to go away. Very common statement. But I think in general, we advise people that, you know, noticing as you are in the program, because sometimes your level of pain may start to change. It may still be there. So having the bar be whether pain is there or not is not as useful. I think I always remind people, let's focus a little bit more on, you know, are you able to get back to the things that you love, things in your life that you miss doing? Are you able to enjoy some pleasant activities in a way that you weren't able to before? So thinking about like function as a better indicator of progress. Of course, it's super nice when along the way the person is noticing that their pain is reducing. That's fantastic, but we don't want people to just focus on that, because then they might miss some of the other positive benefits that are happening simultaneously. So other parts of the program, we also want to focus, as I mentioned earlier, managing mood. So if somebody's having any mood issues, which actually is pretty common when people have chronic pain, because as you can imagine, living with persistent pain, it really, you know, takes a toll on you. It's going to diminish maybe your interest in wanting to do pleasant things. It's going to impact your relationships. You may not want to go out and do stuff with people because of fear that the pain will come on. You know, it can lead to depression, anxiety, lots of different feelings that people can have with their pain. many people report to us that their mood fluctuates throughout the day, depending on the pain. So later we're going to watch a very short video with John Kabat-Zinn that he is going to be discussing mindfulness and chronic pain. And I think that relates completely to this point, because we want to start thinking about how do we separate those physical sensations, noticing the physical sensations from the mood piece, from, you know, becoming fearful, becoming anxious, becoming sad and depressed. Because by doing that, we can start to split those two apart, and we can start to make an impact on the emotional suffering that patients are experiencing. So, you know, for a psychologist, that's really key. So helping provide support, helping patients notice their part, because, you know, they may be doing things that are actually increasing their emotional suffering. You know, I'm just thinking about the last year with the pandemic. A lot of our patients have been very isolated. And so that has been one piece that I've noticed that has really flared a lot of people's pain up. So by me pointing out these kind of psychological aspects, again, I'm not saying it's imaginary, it's in your head. No, it's all related. As we know, your brain and nervous system are responsible for sending the pain signals. And, you know, we're mind, body, spirit. We can't separate certain aspects. All of these components are working together, right? And we know that as well because of the more recent functional MRI studies in the last 10 and 15 years in particular. So improving mood, improving sleep, very important. Helping people become a little bit stronger physically, improving physical conditioning, because a lot of our patients, if they've had persistent pain for quite some time, they end up overprotecting the body, they end up limiting their activities, and they become deconditioned. So that's another area. And in terms of the last bullet point, you see decreasing focus on pain medication as a primary treatment. Pretty much what I just explained. You know, medication has its place, but these other strategies really are what we know from the research that help people in a more you know, strong way, in a more lasting way. And because they are active interventions, right? They're things that you are doing. An important point is that medication alone tends to fail after 3 to 5 years. Inactivity worsens pain because people become deconditioned, right? So that's really important. So it was interesting to hear that you guys have like these movement classes. I think that's fantastic. That's one of the best ways as well to treat chronic pain. Gentle movement, gentle yoga, Tai Chi, Qigong, all of that is wonderful stuff. As you practice gentle movement, you are bringing, you know, fresh blood pumping, fresh oxygen throughout your body. That also helps with decreasing inflammation and helps, you know, reduce persistent pain. So we'll keep all of that in mind. And this slide is kind of what I was discussing earlier, that we are very complex beings. You know, the mind-body connection, the mind, we think of the psychological aspects, your thoughts, emotions, your attitudes, you know, things like that. In terms of the biological aspects, the body, you know, maybe some of it may be what your genetics are, but also thinking about your current health, right? Current conditions you're dealing with. And the social aspects involve a variety of things. So it involves like your social supports, the things that you do, your activities. It also involves, you know, your environment, as I mentioned earlier. So, you know, your neighborhood, society in general. So I think that those all of those aspects are very important. And you see also physical exercise is a part of our social sphere. And so very important to continue engaging that throughout life, regardless of our age, right? So this slide, it basically is highlighting the fact that the pain conditions, persistent pain, are best managed by you. So, you know, the goal of our program, for example, is to give people information, give them recommendations, but then it's really up to the individual, as I mentioned, to practice these things. And also holding the idea as you're doing some of these things that, you know, what are my goals? What do I care about? What's important in my life? What are the things that I miss, right? Maybe you miss some creative activities that you were doing or social activities. So those things are really key. For some people, they, you know, it's a little bit more practical, like they want to get back to work. And I totally get that. And so, you know, being able to work and provide for yourself, your family is pretty much our foundation, right? And so, but I think thinking a little bit higher level, as I mentioned, creativity, music, whatever it is, visual art, any creative outlets are fantastic too, because you are actually creating your own natural opioids. So we, you know, our brains have that ability, the endogenous opioid system. And so, you know, I'm presenting on persistent pain, and it's a hard topic, but I think we also have to remember that our bodies, our mind, our whole system is pretty wonderful. And we have a lot of capacity to heal and recover and get stronger. So that's a big part of our program too. We want to give people hope back because, you know, as I mentioned earlier, sometimes we get patients that are in different stages. Maybe they've been through a chronic pain program before, maybe they haven't. Sometimes we get people that have been in chronic pain for 20 years and they've never talked about it with anyone. So I think that it depending on what stage the person is in, you know, they're dealing with different things, but we support our patients through the process that they're in. But over time, people are able to get back to more of the things that they want to do, right? And so as they're doing that, they also notice, because they're not paying as much attention, not focusing so much on the pain, not trying to fix it, all that stuff, because that's mental energy that you are wasting, right? Because they're putting their energy on things that are more pleasant that they want to do, they do notice that the pain starts to change. And by using the strategies that we encourage people to use, the breathing techniques, mindfulness, noticing your mood and stress, doing something about it. If your mood is, if you're having a negative mood or your stress is becoming, you know, very overwhelming in terms of the level. So doing something in the moment, taking care of yourself. So those are really important factors. So I think this is actually something that some of this content actually applies to any medical condition, or just remembering that it's important to stay healthy over time, such as the slide that you see in front of you. So, you know, these are recommendations for people that have chronic conditions or, you know, just want to take care of themselves. So, but in particular with our chronic pain patients, these are very important elements. As you can see, there's different things in the middle. You see exercise, meal plan, really important to think about, you know, those aspects, because if you, let's say you're doing the exercise component, but you're not eating well, you know, that's important to consider, because we know that things that turn into sugar, white flour, all that stuff, it increases inflammation in the body. It increases chronic pain, nerve pain. So that's an interesting area to consider. And it can be a hard part to change for people, but it can have a huge impact. I always remember a patient that I started working with many, many years ago, and she was doing a lot of good things, but she was still having this persistent pain, a lot of pain flares. And then she, on her own, decided to quit soda, which was something that was very difficult for her. But she noticed after 6 months that her pain was completely different. It wasn't at the level that it was. So that was fascinating for her to, you know, reach that conclusion. And basically, you know, it was her, she made that change happen. So So that's, we can't ignore those parts of us, right? What we put in our body, our exercise, our movement, very important. On the right-hand side, you see other areas, enjoyment, relaxation. So again, doing the activities that make life meaningful, right? And that includes social activities. In terms of pacing, that's another very important component of our program, where we ask people to do things differently, break things out into smaller increments. So it's really important to do that, maybe take little breaks in between. What that could mean if somebody is pacing their exercise is that maybe in the past they were doing a 60-minute, for example, 60-minute walk around the lake. Now that's a little bit too challenging. And so now maybe they're doing, 3 15-minute walks throughout the day, and they're just spacing it out. So I think that that's a better approach to just play around and pace, because you may start to notice that you're going to get stronger. You're doing it gradually or gradually ramping up. Because again, the pacing strategies are very, very useful to try to make changes in terms of the intensity of the pain, the frequency, how you would describe it, the adjectives that you would use to describe your pain. So those are key areas. Pacing applies to anything. It could apply to exercise, the chores that you're doing at home, or even like, this is pre-pandemic. I remember one of my patients took a vacation to Disneyland. And so we really talked about that, because she was going with her family, and what was going to be her approach. She was going to talk to her family, let them know that maybe she wasn't going to be with them the whole day. So that was really important for her, because she wanted them to know that she wanted to be present with them and engage, but she was also going to be taking care of herself. So she was going to maybe go back to the hotel and take a little break and things like that. So I felt that that was a very reasonable approach, and she had a great time. So versus the opposite of not saying anything to the family, going and overdoing it and creating a pain flare that could last, some people have pain flares that are over a week, and that's very debilitating and depressing. On the very left-hand side, you see some of the areas that I've discussed already in terms of stress management being a very key component. And for our chronic pain patients, again, the mindfulness skills are very important. So we discussed, whether people want to meditate or belly breathing. We have a lot of patients that tell us, they just, meditation's not for them, or they actually dislike it. We don't want people to do anything that you don't want to, so that's completely fine. Belly breathing or diaphragmatic breathing actually gives people the same exact benefits in terms of impacting physical sensations in the body, impacting pain. It also obviously helps with calming us down. If anybody out there has issues with anxiety or panic attacks, things like that, breathing is the number one thing. Those conditions are very, very treatable. So if anybody's struggling with that, please talk to your doctor as well. And I don't think I skipped anything. Yeah. So, I've alluded to some of this already, so I'm not going to spend a lot of time talking about this slide, but it does show that there are different stages of treatment in regards to engaging in a chronic pain program. This morning, the patient that I was speaking to, she's newly diagnosed with fibromyalgia. She's starting to learn about it. She's a little bit like overwhelmed by it. So she's still in that initial stage where she just got a diagnosis. She's working on, okay, what does this mean for me in the long run? So she's, having some, I would say, more stronger emotions about it. She's in a little bit of shock about it. She has a lot of sadness, she was telling me, because she's thinking about, well, what does this mean of what I'll be able to do the rest of my life? So all of that stuff can kind of flood people. And so we want to remind our patients that you know, those things are very valid, but over time, as you start to engage in the program, as you start to practice some of the strategies that we want people to do, and as you're receiving support and guidance, you're going to start to get a little bit more comfortable. You're going to start to go through a different process of dealing with it, accepting that you have this condition. Okay, what then? What am I going to do about it, right? So that functionality stage is really where somebody's got a little bit more of a practical plan, very specific. I'm going to start, you know, this is my exercise regimen. This is what I'm doing. Maybe I'm engaging in a little therapy as well for some support. And as they're doing more of that, they're restoring their function more. They're getting back to life, right? And so, but even then, pain flares may still come as people progress. So it's not like you go through the program and you're done, you're at a stopping point. No, it's definitely, the skills have to be practiced consistently. So the breathing, the monitoring your mood, stress, all those other things. And so, you know, I think when we listen to the video with John Kabat-Zinn, he doesn't mention this in this video, I think, but in other videos, he's mentioned how, you know, mindfulness, the breathing techniques, all of this stuff, we want people to practice and have it be consistent, just like you brush your teeth, you know, take a shower, things like that. So I'm going to now switch a little bit and start discussing some of the basics regarding persistent pain. So we know it's a chronic stressor. So sometimes when people that I talk to for the first time, sometimes they are a little bit confused as to why we have pain psychologists on the team. Or maybe they're a little bit, you know, defensive about, you know, having to talk about mood. Many people are very disengaged from that. But, you know, we just remind everyone, it doesn't have to be that you have a clinical diagnosis such as major depression or an anxiety diagnosis or others, but just thinking about the fact that this persistent pain is constantly nagging at you. It's taking away, it's, you know, competing for your attention. It's distracting you from other things that you would rather be focusing on. So it's a chronic stressor. The good news, it's very treatable. It can be managed. Again, it takes time. So I always remind people to notice your expectations when you come into a program like ours. You know, the pain didn't develop overnight, so it's not going to be a quick fix. But noticing the small increments of progress is really important, and building that momentum for the individual is key. So again, we do teach these strategies, and people do report that they have an improved quality of life over time. One thing that I want to, I think this is a really important area, and some of you may be very familiar with this information, but I just want all of us to be on the same page. So in terms of acute versus chronic pain, some really important things to differentiate. So acute pain is new pain. Let's imagine somebody broke a bone. Maybe they broke a toe. And so a few important things to keep in mind in terms of the contrast. So new pain, acute pain versus chronic. One of them is time, so duration. New pain resolves within 3 months. That broken toe, you know, bones, tissues, ligaments, everything heals up usually in about 3 to 6 months. Let's say, you know, that person with the broken toe, it's now been, you know, a good 9 months and they're still having pain. So now it's jumped into the chronic pain realm since it's gone beyond that time period. Another important thing is purpose. What's the purpose of pain? It's an alarm system, right? And so the fact that the person, you know, was, you know, alarmed and, you know, pretty scared when they broke their toe, pretty intense pain. The purpose is to get you to go to the doctor, get some treatment, and follow instructions, right? So it's an alarm, it's a natural alarm system that helps keep us alive. So that's important. I'll switch back and forth. between these two slides. Another important distinction between the two is the treatment for acute versus chronic. So in terms of the broken toe, the treatment might be that the person's wearing a boot. Maybe they're isolating that foot. They're certainly not supposed to go out and play soccer, things like that. They're going to follow their doctor's instructions. But the treatment for chronic pain, when it's gone beyond the 3 months, is really the opposite. So it's no longer to rest and protect. It's to use it more, to use that part of the body more, to not overprotect. So moving it more. So again, the treatment for our chronic pain patients is to use their body more, engage more in movement and activity. And that is where the challenge lies, because we have to remind people that not all pain is the same. Your pain is chronic, it's not acute. So what that means is that you are no longer in danger. As you see here on this slide, the purpose of new pain is to alarm you and go to the doctor because there might be a danger. When it's gone into the chronic pain realm, no, danger is not an issue, but the mind, the nervous system, the mind, the amygdala is interpreting all pain as the same. So the amygdala runs with it and just says, this is really, really dangerous, even though we know it's chronic. So that's a key component of it too, because somebody, once they have chronic pain, they really have to notice that fear and do something different when they are noticing that fear reaction, which can trigger that whole alarm system. So one example of what we have people do when they notice that is to use a mantra and just tell themselves, I am safe, I am safe, because that starts to break that automatic reaction. And over time, also meditation weakens the amygdala, the power that it has to hijack the person. And then you end up having more pain, and you end up having a slew of negative psychological emotions around it: fear, danger, sadness, anger, all of that. Another thing that I want to highlight here is in terms of the cause, acute versus chronic. So again, for acute pain, it's due to a new injury, right? For chronic pain, we have to remember that the brain is misinterpreting nerve impulses as danger. So I would hone in on that word, misinterpreting. And so again, this is where, as I mentioned, the brain and nervous system go a little bit haywire. So by telling yourself, oh, I'm noticing that sensation, I can tell it's getting stronger. And then just telling yourself, I'm safe, I'm okay, this is temporary. And then shifting into some belly breathing is a really good alternative to the other type of scenario. So this slide highlights, I noticed the time. So Yen, what time is the presentation over?
Till noon.
Till noon. Okay, we have enough time. Thank you. Mm-hmm. So let's see. So stress versus relaxation, very important. This is something that a lot of us learned in biology. And the reason we bring it up here is because it's completely relevant in terms of the person experiencing pain in their body. So, when a lot of us learned about the stress response, the sympathetic versus parasympathetic response, we've heard the example of, our ancestors living in the wild. We were at the mercy of all kinds of danger, lurking around the corner. So whether, we were faced with a wild animal or other situations, the sympathetic nervous system is in place to help us stay alive, right? So when faced with a danger, as you can see, all of the physiological changes on the left-hand side, these things happen without our control. So our heart rate goes up, blood vessels constrict, the breathing, we do more of that chest breathing. So it becomes shallow. Our muscles tense up because we're going to get ready to fight this thing off or run away, right? Or the third option, sometimes people become so overwhelmed that they actually freeze, right? So it's fight, flight, or freeze. So muscles tense up, skin temperature drops. So basically the blood rushes to your core, so your lower and upper extremities get cold. Also, if there's any digestion happening, that is put on pause because it's not really that important if you just had a sandwich to digest it if you are in danger, right? So once the danger resolves, the digestion kicks in again. But let's focus a little bit more on the relaxation response on the right-hand side. So the parasympathetic response is our best friend in terms of the treatments for chronic pain. So you notice that this is once the threat has resolved. So let's say we got away from that wild animal, the saber-toothed tiger. And so now heart rate normalizes, everything is normalizing, blood vessels open up again, blood pressure goes down. Breathing, now the breathing can resume and be more of that deep belly breathing, that relaxed breathing, which is what we should all be doing more of. And let's face it, a lot of us don't do that. And also notice that your muscles tend to relax when there's no danger, when the danger has resolved. Skin temperature warms up. Hands should be warm when you are in relaxation response. You know, this is interesting because many times I talk to people and they tell me, well, I don't understand why this is relevant. It's completely relevant because chronic pain now is that constant threat, right? So the fact that the amygdala is running with it, people end up overreacting. They are switching into sympathetic response whenever they are feeling the pain, the discomfort, right? And so, you know, if we can start to make changes in this area in terms of the reaction that you have, it's really important. So as I said, the sympathetic kicks in, but you have the ability to switch over to relaxation response. That takes conscious effort. So the best way to create that bridge is, as I highlighted, deep abdominal breathing. That's your go-to. If you notice the discomfort, the pain in your body, you're noticing your muscles are getting tight, you're not breathing. Okay, I'm going to take a moment and shift into that belly breathing, because by doing so, you know, you're basically in a way tricking your mind into, well, maybe tricking is not the best word, but you're having your mind accept that, yes, that, you know, I am safe, because if I wasn't safe, I wouldn't be doing this deep breathing, right? So it's very much at a body level. It's because it doesn't work if I tell someone, okay, when you notice that you are in sympathetic response, I want you to intellectually bring yourself over to parasympathetic, into relaxation. We can't convince ourselves. We can't talk ourselves into it. It has to be felt in the body. So the deep breathing, best approach. For other patients, that have a little bit more, they're more in tune with their body too. They notice, you know, their hands are always cold when they are having a pain flare. So that's another rich area, because I tell them, okay, good, notice your hand temperature. So part of your homework will be to just keep your hands warm. And so the more that they do that, that's another bridge, right? You're basically letting your brain know that you are warm, that you're safe. If you pair that with the belly breathing, you know, that's where it can get pretty good in terms of the progress people start to make. There's nothing better than when people start to realize that they have more control over these conditions than they thought. So that's always exciting for us to see. And in terms of mood and physical pain, I mentioned earlier, they do interact in the brain. Both, you know, the somatosensory strip, the part of your brain that analyzes pain and physical sensation, are neighbors with the limbic system. So, you know, we've all seen like these diagrams of the brain in different sections that are in charge for different things, but the brain is an interconnected thing. There's neural networks, you know, it's working together. So each part is sending information to other regions and impacting your, your ability to even reach a conclusion. So when we think about like your frontal cortex, which is like the CEO of your brain, when people have a lot of pain, as I mentioned earlier, the amygdala can be larger than in people that don't have chronic pain. Because again, the amygdala has become too strong. It's become too powerful, and it's basically enabling this hijacking so that each time the person has persistent pain, that they really freak out about it. So in these kinds of scenarios, the frontal cortex, your executive functioning, is actually a little bit weaker. It's not, the CEO is not able to say, hey, let me look at the big picture, right? And so the more people practice the breathing, the mantra of this is temporary, I am safe, they're weakening the amygdala, they're strengthening the connections between different parts of the brain and the frontal cortex, enabling you to kind of step back and say, hey, yeah, I don't like this. This is really frustrating, but I've been here before. I know this is temporary. I know I've been able to change my pain before. So that's a very different approach than when you are in the thick of it and you don't think you have any control or able to make any changes in terms of the impact of pain, right? And that's when people start to feel like pain is controlling them, controlling their life. So yes, the nervous system, the brain produce pain signals. We have, like I said earlier, so much more research about chronic pain and the brain, the neuroplastic pain components, and the process of how that works. Yes, so very important to acknowledge mood, depression, any of that stuff if it's going on. We ask people as well in our program to, treat that, whether they are already in therapy or are going to get involved. If they ignore their mood, any mood issues, it's very difficult to make any changes and get better in terms of their pain condition. So, we're looking at the big picture. We're looking at the whole person. And as I mentioned in our program, we use cognitive behavioral approaches. So these techniques, along with the pain management skills, rewire your brain. You actually make neural changes, and that's really exciting. So that's the good news. So Yin, I was wondering if we could cue up the video. This is a brief, a little over 3-minute video, and this is John Kabat-Zinn discussing chronic pain and mindfulness.
Absolutely. So I'm going to stop your screen.
Oh, yes. Here.
Then we'll go over to here. Let me make sure that the sound is working. Okay.
Well, nobody wants to fall into a condition where, you wake up in the morning and your body's hurting, or you can't even sleep at night because your body's hurting. And some chronic pain conditions really are like that. And people who suffer from chronic low back pain or chronic headaches or, facial pain or whatever it is, there's so many different conditions that have pain associated with them. And then you discover what the limits of medicine are, because you go to the hospital and hoping that they'll have some special pill or, in the worst case scenario, some kind of magical surgery, and that it will just make your pain go away. And then, you basically come to a rude awakening, times where you discover there are real limits to medicine, and sometimes the drugs that you would take to alleviate the pain do other things to you that you just don't want to do on a long-term basis. So we see diagnoses and conditions, and we invite them to actually turn towards their pain, tune in to the sensations, and to stop using the word pain altogether, and or be aware of how much you're using the word pain, and instead substitute like discomfort, and then zero in, just drill down into what you mean when you're talking about pain, and say, well, like, what is it in the body? What kind of sensations are they? Are they rending? Are they pulling? Are they crushing? Are they, and there are all sorts of descriptors that actually help us to get a sense of what's called the nociceptive dimension of pain, how it is in the body, the somatic element of it. Then there's all the thoughts about the pain, like this is killing me, it's going to ruin the rest of my life. That's not pain. Those are thoughts, but they're contributing to the suffering. So we can make a differentiation between the bare sensations and the total suffering package that, to a large extent, we're generating ourselves through our thoughts and our, reactive emotions around it. Once you cultivate mindfulness, you learn to uncouple the somatic sensations from all the thoughts and emotions, and that actually, you still have the sensations, they can still be unpleasant, but the knowing of unpleasant sensations is actually liberated from the suffering. And it's just the way things are. And the more you befriend the way things are in your body, the more people find that, you know what, I'm learning how to live with this. Do I want it? No. But is it eroding the quality of my life? Not the way it was before. So you can practice this by just like getting your toe in the water. It's just like take a kind of open look at the discomfort and just feel it, open to it. Just maybe for 15 seconds or one in-breath. Or if one in-breath is too long, try half an in-breath. And then go back to like whatever you're doing to distract yourself or think about or whatever. But then more and more, you like dip your toe in a little longer. Go a little deeper with the foot. And gradually begin to reclaim your body, even the parts of your body that hurt and that you don't want to deal with. And I'm not saying that this is a substitute for medical treatment. This is a profound complement to whatever medical treatments there are. But as I said, in many instances, there are very real limits to the medical treatments for chronic pain conditions at this particular time.
Great, thank you. So I did see that somebody had a little issue with the volume, and I think that audio file, because I've listened to it too, and I really have to turn up the volume. I think it was initially recorded at or uploaded at a low volume. So there is going to be, I'm going to show some resources, but this is something that you could see on your own. If you just go to Google and you look up mindfulness and chronic pain, Jon Kabat-Zinn. But if anybody was having difficulty hearing, basically he's reminding us of several important points that, approaching the experience of having chronic pain with curiosity is really important, because, and that takes time and progress, because as I mentioned in the beginning, many times people come to the program that we have and their goal is to just get rid of this thing. I'm so sick and tired of it. No, I don't want to talk about it. I don't want to think about it. It's just consumed my life, right? So Jon Kabat-Zinn is challenging people to, and again, this is a process, to look at their experience, the pain experience with curiosity, dipping your toe into it, he mentioned, noticing the sensations, because the more you put the spotlight on it, and in terms of noticing it and not having so much of a reaction about it, actually, the more you notice it, you have less of a strong negative reaction towards the sensation. So that's what he's talking about, kind of separating that emotional reaction from noticing the nociceptive dimension of pain. So that takes, time for people to do that. It's not an easy process, but that's where the pain experience can really start to change, because when people have an adversarial relationship with anything, you are fighting with this thing. It's constantly on your mind. If something is always on your mind, it gets amplified. So by people always thinking, God, I want to get rid of it. I'm so sick and tired of this pain go away. In fact, because the mind thinks in absolutes, all the mind is hearing is pain, 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 right? So thinking about that angle, he also mentioned challenging our language, and that's a big part of our program too. We have people, our patients, be aware of their internal language, so trying not to use the word pain as much, using other ways, sensations, discomfort, what have you, a little bit more neutralized, right? A little bit more diffused. So it has a different impact. Also the language that you use with other people. So, you know, for some people, some of our patients, they're talking about their pain too much. And by talking about it with other people, you are flaring yourself up, right? Because it's your focus and you are actually feeding it. And that's pretty much a proven thing that we know from all of the brain research. So really important to also consider that this can happen to anyone. It's not that if you are having this condition that you have to blame yourself or that we are blaming you of anything, but it's more about knowing what the process is, what's occurring when you have pain. It's very complex. And so the more education you have, the more you're able to kind of create these little breaks, right? Putting a pause on like I said earlier, having the physical discomfort and then the chain reaction of the emotions that go with it. Again, those emotions actually come back and feed the pain even more. So it's quite an interesting loop. So I really invite all of you, if you're not doing any kind of mindfulness, the easiest kind is just to do diaphragmatic breathing. If you like meditations, do some short ones. Like in the video, he mentioned even just taking a couple of breaths and seeing how that works. So just keep doing it and don't exactly expect an instant reaction or a difference. Just, again, keep doing it, keep practicing, right? And so over time, it does change the experience of pain for people. So this slide is basically showing different things that can impact pain, contribute to pain. We've covered a lot of these already. Mood, level of activity. We don't always assume that our patients are being inactive. Sometimes patients are doing too much. Maybe they're, last week I was talking to a patient that went on a 4-hour hike and then she had a huge pain flare. So, it's breaking that out might be important. But in general, we always tell people to, if you're not doing any kind of movement, any kind of exercise regimen, it's important to have regular movement. It can be gentle movement, as I mentioned earlier, but it's so key. And so some of the gentle movements that kill 2 birds with 1 stone, where you are moving, breathing, and meditating. Well, it has a meditative approach. The Tai Chi, Qigong, all of those kinds of practices are wonderful. So if you don't like sitting meditation, do one of those. I think those are really nice. But just regular breathing is totally fine too. Noticing your posture. That's something that I always have to keep in mind because I tend to slouch. I'm sitting here all day. But I think for our chronic pain patients, noticing your environment, your ergonomics, all of that is key. And not that we want you to be so rigid about it and overprotect the body, but noticing the impact that maybe if you're overstressing or if you're holding your body in a certain way that is just aggravating more tension and maybe fueling some of the sensations. So I mentioned inflammation earlier. And so, in terms of inflammation, different things can produce it. One of the, I think most of us know that tobacco and alcohol produces inflammation. As I mentioned earlier, making sure to really limit those parts of your diet, your mealtime that are things that turn into sugar, white flours, things like that. And so, again, looking at all of these things together, they can, if they're not, if they're kind of negative, definitely you can see the picture that somebody's going to have more extreme pain, more uncontrolled pain. Previous pain experiences. So that's interesting too, because, our brain keeps like a filing system of all of the things, all the injuries we've had. And, that's a good and bad thing. It's good in the sense that, yeah, it's a way to protect yourself. Bad in the sense that you may be overprotecting. And one example of how previous pain experiences can impact current pain, You know, a month ago, I was working with a patient that he was in a pain program like about 15 years ago, and then he was doing really, really well. And then he just returned to us. And part of it is because he lost his job. And so this triggered this stress, triggered the chronic pain to come back for him. And it actually, he was telling me that in feeling the pain currently, he was able to kind of tap into how he felt emotionally 15 years ago when he first had the pain. So I think that that's really interesting and something that he was able to talk about it and get off his chest. But also when we think about neuroplastic pain, so, you know, pain is in the brain, and the fact that the pain is generated by the brain. Sometimes when people have, for example, low back pain, maybe it started with an injury, but now that injury has healed. It's now been, you know, a couple years down the road, and they're still having low back pain. I'm going to show you guys in just a little bit the slide for a physician, Howard Schubiner, that's doing a lot of wonderful work. He has his own website in terms of this kind of work, the neuroplastic pain. But he challenges people to think, if you have low back pain, for example, if you just even imagine, you know, doing one of those things that triggers your back pain. So imagine lifting a box, or imagine vacuuming, whatever it is that triggers it. And if by even doing that, that triggers the pain, that's neuroplastic pain. So we want to acknowledge that that's that centralized pain process where the brain has gone a little bit haywire. So keeping all of that in mind is important, because again, we want to recognize that that's neuroplastic pain and there's no danger here, right? So really convincing your brain that you are safe is really tricky and important.
Emilia, before you move on, we have a few questions about what does ETOH?
Oh, sorry, that's alcohol. I should have written alcohol.
Okay. And then I just wanted to do a quick time check. So we have,
yes.
Could you wrap up in about 5?
Yes.
Okay, great. So we have time for questions.
Thank you. Thank you
Wonderful.
for reminding me. I think we're wrapping up. So
okay, perfect.
All flowing quite well. Okay. Thank you. No, I appreciate that, because it's, you know, sometimes we get too into it and then we lose track of time.
Exactly.
Yeah, so neuroplasticity is, here, I'll just jump to Dr. Schubiner. So his website, Unlearn Your Pain, and I also shared with Suyin a document that has some of these resources. But if you just Google Unlearn Your Pain, Howard Schubiner, you're going to find his website. But he talks about the 5 F's that increase pain. And, you know, this should not be any surprise to you, but fear with the pain is going to trigger it, frustration, again, trying to fix the pain, fighting with it, focusing on it. So if you have persistent pain and you're doing these things, this is really key. It's key that you start making some changes in these areas. And okay, so let me actually come back. So again, neuroplasticity, what Dr. Schubiner is really highlighting in terms of chronic pain. Again, the good news is that our brain has the ability to rewire itself. You can retrain your brain. So the misinterpretation that is going on in your brain with the pain signals and thinking that you're in danger, you can start to create new networks. And so this is a video that I would like all of you to watch on your own, because we don't have time today. It's only 2 minutes, but I think it's quite brilliant because it shows visually the different networks. It gives you an idea of when you do different things, different behaviors, when you think differently, you are making changes, right? Kabat-Zinn mentioned how we can regenerate and regenerate our bodies and mind just by changing our thoughts, right? Changing our behavior. So that's very, very powerful. So if you guys can please look this up on YouTube, Neuroplasticity by Sentis. And just a reminder that neurons that fire together wire together. So the purpose is to try to start weakening those networks that have become too good at sending pain signals. And we're going to start creating different networks so that you can, again, create more of a pause so that you don't overreact, and then you shift into your strategies that will help you in the moment to quiet down the body and quiet down the mind. This is just a quick slide. I don't want us to focus on the actual diagnosis here, but it's a slide that is very interesting. It shows how common these diagnoses are as we age. So degenerative changes to the spine are inevitable. We're all experiencing them. I like to focus on the first one, disc degeneration. As you can tell, the older we get, more of us have it. Actually, it just basically means that our spine is aging. So as soon as a baby is born, that's happening, right? So people in their 50s, 80% of them already, have it. In their 80s, 96%. The key thing about this is that these people are asymptomatic, no pain. So some of these diagnoses, very scary sounding. Disc bulge, let's look at that one. People in their 80s, 84% of the people have this diagnosis, but that means that 84% of the people, these people have no symptoms, no pain with having this scary sounding diagnosis. So I only show that to kind of challenge people's ideas of, sometimes people are too focused on finding a diagnosis, they get one and then they really run with it. So I think medical terminology can be very scary sounding for the general public, and it doesn't have to be. A lot of these things are very common and does not mean that you're going to have pain. So here's another interesting one. Let's see, MRI and CT findings. So these are people that have low back pain. Part of my slide is covered up. I can't really see. Oh, sorry. Individual without low back pain, keyword. So again, thinking of wrinkles on the spine, wrinkles on the inside, right? So the graph is showing the older we get, the more that these situations happen. The purple line, disc degeneration, as I said earlier, going up, all of them are going up, but these are people that don't have any pain. So just another reminder to not be so focused on diagnosis and try to focus a little bit more on what you can do about it, right? So that's kind of like the whole point of my presentation. So these pain self-management strategies are really what I want everyone to focus on, whether you have persistent pain or not, because pain, I think most of us have pain here and there, but just to try to keep healthy and active is all of these different components that you see on this slide are part of staying healthy, staying connected, getting the most out of life. So we've discussed all of these different areas. I don't think any one is more important than the other. They're all very important. But I would say if I had to highlight a couple of them, I would definitely, if you're not exercising, that's an important thing to start doing some kind of gentle movement. The meditation, the breathing, again, I'm going to highlight those two. And the third one I'm going to highlight, I don't know. I think I would add an extra one, maybe mood, monitoring your mood and stress, which is not here, but I'm just going to throw that one in there. But you see sleep, all of it, very important, what we eat, taking care of yourself, right? And so this is a slide that we show people at the end of our class, just a reminder of their commitment as to what they're going to do when they notice a pain flare, when they notice the sensations. So being very specific, very, very practical sheet to have on hand. If you want to take a screenshot of this, I'll come back, or if you can do that now. But things like, I will remember to breathe and use relaxation or meditation strategies. I will use these strategies to cope with unhelpful thoughts and so forth. Again, it's a good reminder that you have, a lot at your disposal. So these resources, I think Su Yin is going to share with you, but the YouTube videos, some other YouTube videos, there's content by Lorimer Mosley. He has a really good TED Talk that is really interesting, some helpful books. the websites that I mentioned, Howard Schubiner's Mind Body program, Unlearn Your Pain, and the Curable is an app and also a website. And there's a really good podcast. If there's anything that I would want you guys to do, it's only a 29-minute podcast. It's really informative. I would really encourage you, if you're dealing with persistent pain, to listen to that. And I will try to, actually, no, I was going to put it in the chat box, but that's also in the list that I gave Su Yan. So that's all I had. So let's see in terms of any questions that people had.
Yes, thank you very much, Dr. Moreno, for this very interesting talk and all the information you gave us. We have a few questions, and because we don't have so much time, I try to take some first that are very specific, like, for example, exactly how does acupuncture work to reduce and eliminate pain?
So that's a good question. I think the answer would be too long. I would say you can look that up on the internet. I am not so familiar with the research on that, but our acupuncture department has a lot of research on it, which I'm sure is available online as well. And the fact that Kaiser is offering that, it speaks to that it is a legitimate, recognized intervention.
It definitely is.
Yeah.
How does PTSD affect chronic pain?
So that's a good question. So when we think about PTSD, we can think about if it's untreated PTSD, somebody's experiencing, maybe flashbacks, intrusive thoughts, hypervigilance. So all of that, I would say, probably is worsening the chronic pain, because already the person is in constant stress response. They're constantly on guard, being vigilant. So when we go back to that stress versus relaxation response, I would say that person is constantly feeling like a threat, right? That trauma, the unresolved trauma, is that threat. So if you compound chronic pain on top of that, I think it would feed it. So for somebody dealing with PTSD, if it's unmanaged, we would want them to get into some therapy. PTSD is very treatable. And then once the PTSD symptoms start to subside, I think the person would start to see that their pain would also start to quiet down.
Another question was about biofeedback. Please describe the use of biofeedback for chronic pain.
So that's a really interesting area too. So biofeedback, we think, just in the quickest way I can describe it is kind of like thinking of putting a mirror up to your body. So it's a way to, in vivo, in the moment, notice physiological changes as they are happening. So the way biofeedback relates to chronic pain is that there's different ways to do biofeedback. The more traditional ways, there's a lot of expensive equipment involved. For example, electrodes hooked up to your body to pick up muscle tension, for example, here, or picking up skin temperature, and picking up heart rate variability. So different kinds of input going into the machine, and then as someone is watching, for example, a common machine will give you an output of noise or a graph. So let's say it's an audio feedback and it's a pretty piercing sound. If it's high, it means that these things are a little bit out of sync. And as the sound goes down and becomes less grating, it means you're doing a good job, right? And so one way that somebody can do that when they're hooked up, if they are in a pain flare, they're probably not breathing well, they're tight. They focus on their breathing. So by doing the belly breathing, they actually can start to visually get the instant feedback that I am making changes in my physiology. And that is amazing and powerful for people because they start to realize the power of their mind, the power of these interventions. And so the more that people focus on those kinds of strategies, they can change their pain. When it comes to biofeedback, I think initially the goal is to teach you to recognize that pattern that you have, that kind of control. And then over time, you can do it without any kind of machine. Also, there are newer, I haven't used any of them, but there are apps that you use, you know, the camera, and you put your thumb there, and that acts as a biofeedback device. It's picking up your heart rate. And so, you know, those are interesting too. I've heard some mixed reactions to that. For some people, it's a little hard because you have to keep your thumb on there pretty tight. And sometimes when your thumb comes off, the reading gets a little bit off. But it's just to say that there are different types of equipment. Hopefully there will be more newer things like that that are more accessible to people.
Another question was about nightshades. I've heard that nightshades exacerbate pain. Can you comment on this?
Night sheets, what are those?
Nightshade, oh. I mean, like, you know, I think tomatoes, for example, I think is a nightshade, no? I mean, I think it's, right?
Yeah, I guess I don't know too much about that in terms of tomatoes or I don't know if there was more content, but I guess the question is speaking to very specific dietary issues.
Yeah, I guess, yeah. So.
Yeah, I'm sorry, I don't really know too much about that. I think that I like these questions because I think that it's opening up our mind in terms of thinking of all aspects, different components, right? So maybe if you had that question, if you wanted to follow up with your doctor. And I also caution people when you do like Google searches, sometimes it can lead you down a rabbit hole and scare you more than necessary. So I would definitely consult with one of your treating providers.
Yeah, and actually somebody just commented, Sally just commented and put in the chat box, potatoes, tomatoes, peppers are nightshades. So.
Oh, okay, yeah. Yeah, interesting. Yeah, we tend to focus a little bit more on like I said, the things that create inflammation, but I guess those things can also have, I'm just thinking of like the acidity level can be impactful and keep people up.
So next question, what are your thoughts about fibromyalgia treatment modalities?
Yeah, so that is a very common diagnosis that we get in our program. And so the treatment modalities for fibromyalgia are pretty much the same thing that we just covered. It is widespread pains. People with fibromyalgia tend to have a little bit more. I think the commonality is they've had other traumas and things like that in their background, maybe growing up, but it's, you know, pretty much nerve pain, widespread firing up of pain. And so the treatment modalities are the same, the breathing, the noticing your mood, really monitoring your stress level, asking for help when you need it, asking for a break if possible. And the movement, number one for fibromyalgia. A lot of patients, when they have these fibromyalgia pain flares, they end up in bed for, you know, or they stop, you know, all activity for a few days, and that actually makes it worse. So shifting into some gentle movement, connecting, getting some support, because also a lot of people with fibromyalgia or just chronic pain conditions in general, they look perfectly healthy on the outside, and it can lead to a lot of silent suffering.
So I think the last question we have time for, right, Suyin? It's about, yeah. So it's a question that concerns Ashby Village, actually. And I'm not sure you can comment on it, but I read it to you. A majority of programs at Ashby Village are sit-down, passive ones, such as this presentation. What would you recommend to rebalance active with passive programs?
Oh, that's a really good question. So I will only speak to what I can say about that since I'm not a part of the organization. But I think that even we here at the chronic pain program, we have a weekly 2-hour class, and the same thing, we have people saying, you know, like we're sitting for 2 hours. So what we try to do during our class is we always invite people to get up and stretch, do what you need to do. So it's not weird for us when we're watching, you know, the participants and we see people getting up, doing stuff, and it's very normal to us. And we actually incorporate movement into our class. So I would maybe challenge you all, if it works, I mean, to do something like that, where if it's not the group doing it together, that you have the permission to, if you are feeling a little bit stiff, get up and move, you know, stretch. And the more you see people doing it, it just becomes more normal, right? But I think that if some of you are, you know, there's so many, the pandemic has been a rough go, but it's brought on a lot of changes that have been interesting in terms of telehealth and more classes online. So, you know, being able to think about that piece, if you're not getting kind of the movement maybe that you would like from Ashby Village, what are your other resources in the community, right?
Yeah. So I think that's all we have time for, right? So back to Jeanette, I mean, for a few final words. Thank you again, Dr. Moreno.
Oh, you're welcome. You're very welcome.
Yeah, I'm going to stand up for this because I could do that too. Thank you so much, Emilia, for sharing your busy day with us. That was wonderful. And everybody, thank you so much for being here. I think our next Kaiser Permanente presentation will probably be early summer. So get out there, have a good day, and get some exercise.
Yes. Thank you, everyone.
Bye.
Bye.